Addiction is costing the Australian economy $80 billion a year. That's according to a study carried out by KPMG. It's found one of the biggest problems is our reluctance to seek help. On average, it takes 18 years for people to try to address their addiction. Joining me now to discuss more on this, Andrew Dempster, Mental Health Advisory Lead with KPMG. Thanks very much for your time. Maybe I was slightly surprised at tobacco and the cost of that, because the perception is no one smokes anymore, but I guess a good 10% plus smoke, $36 billion a year. Is it just the fact that it's still such a fatal habit?
Absolutely, yeah. So it's really, that $36 billion is almost twice as much as alcohol. We do $22 billion. And I think the leading cause of cost associated with tobacco is really the health costs and the loss of life costs.
Yeah, so health costs, and it can be a horrible, slow death, to be quite morbid about it. And also, if someone dies at 50, well, they're at the peak of their earning power, they had longer years to give and give back to the economy and so on.
Absolutely, and I think any sort of economic modelling that we do when we look at the productivity and the wages or the investment that people will make back into the economy and the taxes that they pay, obviously, premature death really takes away from that, and the losses are quite profound when we look at tobacco.
Alcohol, $22.6 billion. There's a difference in the sense that a moderate drinker might be totally fine and a moderate smoker not so much. Where are the big costs here? I assume not as many people dying, but there's a lot of serious disease.
Still a lot really heavy health impact, so GP and hospital costs. But also, when we look at alcohol, there's also some of those policing costs and the like as well. So looking at policing, courts and corrections costs that are involved in alcohol.
Right, not to mention, the breakup of families. Drug addiction, interestingly, much lower costs, and even when you factor in illicit drugs and prescription drugs. What's the bigger one compared to illicit or prescription?
Yeah, well, look, it's an interesting area. I think one of the key areas when we looked at, there were 7 studies that we examined looking at the cost of both illicit and prescription medication usage and the harms caused by both. Only one of those studies actually outlined prescription medication usage and the misuse of those. So
as a singular
issue.
Right. So $13 billion is the overall, and it's been hard to split those out.
Yeah. So it really, one of those critical gaps in the research is the misuse of prescription medication. I think when we consider as well suicide and the overdose-related deaths, largely caused by misuse of prescription medications.
So it's interesting that not as many people are actually trying to find that as an isolated cost, even though it might be quite surprising.
Yeah, absolutely.
The last big one, gambling addiction. I suppose one of the risks here has been highlighted as self-harm. The obvious one you think of is a family, mother or father, losing more money than they should, and the despair that they're thrown into when they think of what's happened. We're in the grip of that sort of gambling fog, and then what's happened when they wake up the next day, whatever it might be.
I think this is one of those areas we're well beyond the individual, and the sort of financial cost to that individual is really that sort of impact on the family. And I think often, really the research highlights that 90% actually use lies, deceit to sort of cover up some of those financial losses. So it's often a real surprise and shock to the family.
18 years on average. This is what I said at the introduction to seek help for addiction. Do we know what finally triggers seeking help, so you can bring forward the trigger point, I guess?
Yeah, I think, unfortunately, at the moment, as it stands, really the trigger for seeking help is reaching crisis point. And I think there's so many more opportunities to sort of put your hand up earlier and actually talk to people, whether it be a GP, a trusted friend, a kind of different service providers. But we really don't have that opportunity built into the kind of service and support systems that we've got. And I think that stigma and worry about how people are going to be judged really stands out as being a barrier for people seeking help earlier.
Andrew Dempster, great to get your thoughts today. Thank you.
Thanks, Tom.
If this story has raised any concerns for you or a loved one, you can call the 24/7 National Alcohol and Other Drug Helpline. There's free and confidential counselling online at any time. You can call National Gambling, 1800 858 858. There's also gamblinghelponline.org.au, Lifeline as well.